So mommy makeover basically is to reverse the effects of pregnancy and childbirth on a woman. And the basic procedures in mommy makeover are breast surgery and tummy surgery. That is, the breast surgery could either be a breast lift or a breast lift and augmentation, that's increasing the size of the breast, or it could even be, in a few cases, a breast reduction and a breast lift combined. And then the tummy procedure, mostly a tummy tuck, sometimes could be liposuction and tummy tuck together. So this is the minimum and a very basic procedure for mommy makeover. There are additional procedures that can be added depending on the individual and depending on what your preferences as a person or the part of your body you want to improve. So we could add to this like vaginal tightening, or maybe liposuction, thigh lift, thigh liposuction. All these can be added. Even in some instances, a facelift as well. So, but the basic procedures in mommy makeover are breast procedure and tummy procedure. So if you feel concerned about the effects of pregnancy on your body and you want to reverse some of these effects, you want to go back to your youthful self, the way you were before you became pregnant, we are here to help, and we can achieve this goal for you, through surgery. And these surgeries can be done very safely with satisfying and gratifying outcome and result. So the effects of pregnancy do not have to be something you cry over, you lose sleep over. All these effects we can address, and we can actually remedy the effects. So if you have any question you want to ask about this topic or any other topic, please feel free to send us the questions, and we're going to answer the questions for you. So I will go on now to give a bit more detail on these procedures. So when we do a breast procedure for mommy makeover, so I said this could be a breast lift. So, and basically we do a surgical breast lift, and this is a procedure that we do, and then the next day you are home. Sometimes you can even do it as a day procedure and you go home if you need only a breast lift. So when the breast is falling, is sagging, we can actually make the breast a bit more useful and more compact. And then also, for some people, the size, or what we refer to as the volume of the breast, may have gone down. We can increase the volume of the breast and lift the breast at the same time. Increasing the volume of the breast or the size of the breast, we can achieve this by using a breast implant, mostly a silicone implant, or we could also use fat to increase the size of the breast, and then we can lift the breast as well. And in a few instances, some people may actually need a breast reduction because through pregnancy, breastfeeding, the size of the breast has increased, and some people may even have symptoms from this, including upper back pain, mid back pain, shoulder groups, and then a few people even neck pain, pain in the neck because of the size of the breast. So in all these instances, we can reduce the size of the breast and lift the breast at the same time, so that you can have a satisfactory result. And usually when we do this, the symptoms will go away. So these are the various forms of breast surgery you can do for mommy makeover. Now coming to the tummy, so mostly we do a tummy tuck, and which we call abdominoplasty. And the reason we need to do this because when a person is pregnant, the tummy will increase in size. It will stretch to allow for the baby that is growing in the womb to grow. So after childbirth, these tissues we expect them to shrink back, but a lot of times they don't shrink back completely. So what are the tissues that are stretched during pregnancy? One, the muscles in the tummy are stretched. What you call the fascia, which is the white tissue that gives strength and protects the organs, is also stretched. The skin is stretched, and all these tissues may not return back to their size that you wear before pregnancy. So what we do during tummy talk is to repair all these tissues. So we'll repair the fascia and the muscle, will make them tighter. So this will make the tummy flat, and then we'll remove the excess skin also. In addition to tightening and repairing the muscle and the fascia. So then we remove excess skin and then we close up. And in some instances also we need to remove fat. So we remove the fat first. Then after removing the fat, through liposuction, we'll now repair the muscle and the fascia and then take off excess skin. So this is sort of like what we do in tummy talk. So these are the two basic procedures for mommy makeover. So additionally, we can do other procedures. Okay, so we have some few questions. Before I continue, we have a few questions here which I will just answer. The question here: can one have a mommy makeover more than once? Yes, it's possible. For most people, we'll do it once, but yes, it's possible because I've had clients who maybe after 1, 2 children want to work on their tummy, on their breast. We can do that, and this does not stop you from becoming pregnant again. You can actually become pregnant again, and then later on, you may decide that actually you want to improve the tummy again, maybe after some years, and we can do some procedures. Normally, what will happen is that once you have the procedure the first time, the second time, what you need to do will be quite more minimal, not as extensive as the first time, as long as it's done well and properly. So yes, you can have the procedure more than once. And I've had patients who have come to me, clients who have come, who want to have mommy makeover whilst they've not finished having their children, see up hope and intend to have more children. So yes, you can do it in between having your children. You can work on the breast, can work on the tummy. Yes. And then okay, the risk of having mommy makeover. Yes. So every surgery has its own set of complications and risks. There are risks. But we can actually mitigate all this risk. We can plan to ensure that you have a very good experience. And they will do this first through a consultation. So that's why we always encourage people to have a consultation. When you have a consultation, we have your medical history, we examine you, and we find out if there are any medical risk you have. They will do a set of tests to check your organs, to make sure your organs are in optimal condition for surgery and anesthesia. So once all these things are well taken care of, and you are planned for surgery properly, you should not have any complication that will touch on life or that will cause a disability. Those actually should be completely avoidable. So that's the way I'll answer that question. So of course, every surgery has a set of complications that has to do with the surgery itself or having to do with anesthesia. But the vast majority of these complications are preventable, and we'll do everything to prepare you and prevent all these complications. Some people may have some risk factors, and what we do, we get adequate physician review ahead of time, and we take necessary steps to control whatever risks the person may have. So, for example, somebody may have the risk of maybe heart disease because maybe the person is hypertensive or somebody is diabetic. So we will control all this. Make sure you control your blood pressure, control the blood sugar before you have surgery. Or maybe somebody is an asthmatic. So that kind of person, has the tendency to have certain respiratory complications or difficulty with breathing after surgery. So we'll know ahead of time the person is asthmatic. So there are certain precautions we can take to ensure that after surgery, the person has a very smooth experience and this is not a problem. Yes, so you can keep your questions coming in and I will answer your questions. So I was explaining the various components of mommy makeover. We'll talk about the breast, we'll talk about the tummy. Now you can also have a vaginal tightening because some people, especially people who have had vaginal delivery, not CS or surgical delivery, the vagina would have stretched and have become very lax. So we can actually take out some tissues and make the vagina tighter and sort of make it more like a younger vagina. Then also, as part of mommy makeover, some people may want to work on their arm. So we can do liposuction for the arm, or can even do an arm lift, which will include also removing excess skin from the arm, or we'll just remove fat, and then that will slim the arm down and make it easier for you to buy the kind of dresses you like to wear and to wear the kind of dresses you want to wear. Then also sometimes we can also work on the thighs. We can do a liposuction on the thigh. We can do a thigh lift as well. If there are excess skin there, we can remove. And then some people may also want to reduce fat from their calves. We can do all that. So sort of, and the whole goal of this is to restore your body back to its youthful self, and to sort of mitigate or reverse the effects of pregnancy and childbirth and breastfeeding. So if you have any questions, you can send in your questions and we'll answer them. And then even after we finish, if you have any questions later on, or your friends, you can post the questions online, send them to us either on Instagram DM or maybe on WhatsApp to our WhatsApp number, which is 0815 945 1311. So you can send questions to this WhatsApp number, and then we'll do our best to answer your questions and provide clarification. I'll give the number again: 0815 945 1311. So with the makeover lip scars. Okay, so when we do like breast surgery, we situate the scars in a way, the scar in a way that it will blend, and then there are ways we can manage the scar to make them very faint and not to be very visible as such. So we place the scar in a place where they can blend with normal skin creases, so that the scar is not very obvious. So scars should not be a problem in mommy makeover, because we manage the placement appropriately. So we're going to stop here for this evening, and we thank you for joining us. Next week, Thursday, we'll be here again, and we invite you to join us. Invite your friends as well. If there are topics you want us to cover during these our live sessions on Thursdays, you can send us a message on WhatsApp or DM to say, please, we want you to cover this topic, talk about this, and then we'll talk about it, and then bring sort of enlightenment and understanding to you, so that you can make your decisions in a very enlightened way and with information and guidance. Thank you very much for joining us this evening. We look forward to see you again next week.